All right. Hey, everyone. Todd here, internalarchitect.com. Had to come out here to my little office and kind of redo this last video that I did about my CT scan today. Just for some reason, it didn't want to record my audio on my phone. So sorry about that. I do apologize. So this is kind of what happened. So for those of you that are following, I ended up starting down this road this past Wednesday evening or Wednesday when I went into my doctor's to get a just a checkup on and kind of figure out why I was having some breathing issues going on. And most of this came about because of one, living at altitude, and two, because I'm biking a lot. And I was I'm just not breathing as good as I was this past year and for the prior years, but for whatever reason, I'm just not breathing super good. So we ended up kind of at the time, it was a bit of a morning appointment that we ended up kind of thinking it was a little bit of sport induced asthma. And I was like, okay, whatever. And then I didn't get a call back from my doctor for a little while because we did some chest x-rays, and he wanted to talk to the radiologist and see what he thought about him. So I didn't hear back from my primary until almost 5 o'clock. And he kind of was a little bit concerned about what was going on there. And it turns out that it shows in the x-ray that there's a little bit of something going on in my chest and in my lungs, maybe a little bit of pneumonia perhaps, but don't know yet. And I guess there was also a spot or something that seemed to be a little concerning for the radiologist. So that's how this whole thing kind of happened. So fast forward to 72 hours, and today. So today's Saturday, the 13th of July. We went. I had an appointment for a CT scan with I'm blanking on it. With contrast, and that's just an iodine solution they give you an IV for during your scan. And it went real quick. It went real quick actually. About the total time inside the machine was 15 minutes, and I was done and kind of on to the rest of my day. And so I kind of just spent the rest of the day relaxing and taking some time to just, I don't know, I guess a little bit of meditation, a little bit of sleep, and just kind of napping, some stretching, just a little bit of all the above I just needed to take some time, a little bit to kind of just give my body a little bit of love. And so that's what I did today. And I just kind of assessed kind of what all this means, because I've already been through one reoccurrence at this point, and just trying to compare my feelings then, which was almost 10 years ago at this point, to now. And there's definitely some differences going on and some different feelings and different, obviously, circumstances, but nonetheless, the feelings and emotions that I'm feeling now are incredibly real and incredibly fearful of what might lay ahead. And now that the scan is done, I have to deal with the possibility of my cancer coming back, my lymphoma perhaps, or a secondary cancer. Who knows? There's a lot of different possibilities, and I'm not going to speculate. I don't want to speculate because I don't want to let my mind start spinning down that rabbit hole and just go down into a bad, wrong place. And so it was good to kind of take some time today to let myself just adjust and assess what was happening all at once. Right. So definitely scary. But taking a little time to rest and just get caught up. I feel a lot better, and I feel good knowing that, what is happening. All the facts that I know at this point are looking really, really good and positive. So I'm hopeful and optimistic that there's just something going on with my lungs as far as a little bit of pneumonia or some weird something going on there. So we'll just kind of see how that unfolds. The tough part that I'm going to be dealing with for the next 4 days or so is the anxiety of the waiting for results. Now, for most of you who are cancer survivors and patients, you absolutely understand this, because when you get a scan done, it's all just a scheduling thing and trying to be able to get the results and get that information as soon as possible, because we want to have that information as fast as possible and to give ourselves a little bit of solace in knowing kind of where our situation is at that present moment. But the tough part is, and that's, I think, some of the fault of the medical industry is being able to get that information as soon as possible. But because there's so many parties involved, it's really hard to do that. With the timing here, I found this whole thing started on a Wednesday. I got the soonest available appointment for a CT scan, which was today, which was Saturday. And then I got the earliest appointment for a new oncologist, which is Wednesday. So I have about, 1 week of time, almost exactly 1 week of time before everything happens. Right. And, it's all scheduling thing, and it's all just, everyone has lives and everyone does what they do, including medical professionals, but it doesn't change the fact that you still want to have answers and results immediately. So, yeah, so I have about 4 days of waiting around and trying to just be patient. And what I was saying in the last video was, and the one that doesn't have audio, was I am just trying to figure out the best ways to kind of keep myself and my mind kind of from spinning out. And I'm going to be biking a fair amount over the next few days, probably be biking to work, biking to, just to stay busy. I think that's going to be the healthiest way for me to really kind of focus on what is important right now. And that's to not think about these results 24/7, because it's really easy to feel all this stuff going on. The other thing is, I'm just thinking about, kind of the comparison of where I was at. So beforehand, and by being able to make all this come together, I think I'll be able to kind of make the next few days a lot more pain-free, I guess, so that we don't have to, especially for my family, have them see me deal with the fear side of what I'm going through. So yeah, so that's kind of the thing. And I'm just going to try to stay really, really active. I'm going to try to not be at home and just trying to be, complacent and lethargic. I'm just going to try to be active. I had a good afternoon of just resting and just kind of letting my mind kind of absorb just what has happened in the last 72 hours. And I actually feel pretty good about myself right now. I'm absolutely scared though. I have a lot of fear going on right now, but I feel really good and confident that the outcome, whichever way it goes, is going to be good. So, I think I'm in a good place right now. I feel like I'm in a good place, and I think it's I think it's going to be okay, no matter which direction it goes, because at least I have the mindset and I have the knowledge to be able to kind of attack this, whether it is like a little infection going on in my lungs or if I am having a reoccurrence. So yeah, things are all right at this point, but I want you guys to know that the fear is very real, and the fear and anxiety are definitely something that you need to be aware of, because when this happens, it definitely is throwing everyone for a loop. I mean, my family is all twisted up right now. My wife has her anxiety just went through the roof, and my daughters are are really having a bit of a time with this, because they understand just how crazy this was to begin with. And they saw just how much I went through and endured with my first bit, the first, when I was originally diagnosed. So they're very aware, they're very conscious of it. And, as caregivers, they're reliving a lot of the old memories of what is happening also, and what happened then too. And my girls have grown up a fair amount since then too. So yeah, they're having a really hard time with it also. But that's the other reason why it's really important for me to really, I don't want to suppress my fear and suppress my feelings and everything, but I need to show strength and leadership to them, to make them feel good about where I'm at also mentally. Because if I feel like I'm defeated, well, that might really change the whole game. Not only for me, but for my family too. And I'm not going to allow myself to let that happen. So yeah, I just wanted to at least get a video out there that had what I was trying to say on this last one, but with audio. So, please hit me in the comment section below if you have any questions, and hit subscribe so you get notifications when I put a video out. I'm going to be trying to do videos probably daily for a little bit, or every other day or something like that at this point, just to kind of, I want to be able to keep sharing my thoughts and sharing my emotions and feelings and stuff with you as this kind of progresses, because I think it's important for you all to know how this kind of unfolds for myself and for my family also. So that way you have a little bit of an idea of how to deal with this as it comes up. So yeah, thank you for watching. Thank you for listening. I really appreciate your time and your energy into watching this and watching all my videos. And if you have if you're kind of curious about all the different stuff that goes on for while in cancer, whether it's financial or mental or psychological, or I guess all the above there, scroll through my channel. I have all sorts of videos that really cover a lot of really important topics. And I'm going to slowly start redoing some of those also, just to kind of update them, and as I feel a little bit more confident in front of the camera too. So, all right. Well, thank you for your time again, and I will probably see you in the next video.